All right, welcome everybody to this edition of your Freedom Hub's Free Market Cash Patient. I'm your host, Jeff Cantor, along with my co-host, Charles Froman. We're excited to have you here today and also wanted you to be able to come to the future events. And so here is the web domain to go to be able to subscribe for future guests. Also, very importantly, we are recording these and they will be available on a regular basis every weekend. These are always released. And so you'll be able to see all of them on whichever of these is your favorite viewing channel. As a quick diversion, let me show you real quick. When you go to log in and sign up for these, you'll land at the landing page. This is what some of the video pages look like. This is a very large one. This is one of our larger collection pages, as well as being on YouTube. So I really appreciate that. And then so today we have something very exciting. So we're going to want to find out a little about that. And we're going to have Charles actually step in here and give a little bit of an introduction.
Sure, Jeff, and welcome, Jeff. Since we're all colleagues in our innovative efforts for the health market, we have Jeff K and Jeff E. And Jeff E., Mr. Ellington, will present tonight. And since the 80s, he's run something called Creative Capital Companies. And then in the 2000s, he started consulting with physician practices and how they deal with their employers. And most pertinent to tonight, for the past year, after a few years of different iterations around this name of Concentric, Concentric DNA is his grand effort to coalesce and bring together a lot of folks in health research at the universities and incumbents with the big company benefit brokers and big hospitals to figure out how to bring them in to his version of the solution for healthcare. So many innovators want to disrupt and take on incumbents. Jeff's big thing, which is great, is how do you entice the existing players to join this paradigm shift? And so that's our preview. That's our introduction, Jeff.
Okay, well, that certainly sounds pretty exciting. So let's find out what it's all about. Jeff, I'm going to give you back control of the screen.
So thanks everyone for showing up for this. I have been at this sort of quest for quite a while, and it's taken quite a lot of patience to sort of just stay with it, as I think anybody who's trying to really impact change certainly develops quite a bit of resilience along the way. But for tonight, I thought it would be worthwhile to try to put what we've been doing in some sort of context, so it's as relevant as it can be. And so I would start out with a question: is making healthcare intentionally driven what the market wants? Okay, so we're good. So that's sort of the question that I felt like would be a good one to ask, because that's really at the heart of what so many of us are trying to do is take this this challenge of fee-for-service healthcare, where everybody's trying to make money on something that nobody really knows how to value, and everybody's out of money, and a lot of with a lot of employers, it used to be that most people wanted coverage if they could get access to it through their employer, and now it's gotten to the point where a lot of people don't even want it because there's so little value involved. So it sort of begs the question: is making healthcare intentionally consumer-driven what the market really wants? Because we sure as heck aren't getting there, and it doesn't seem like anybody's trying very hard. And so I thought it would be worthwhile to point out a couple of different sites that I pulled up while I was sort of process, and just to try to bring some credibility behind what we're all trying to do. And this is a site that's put up by Deloitte, which is I think they're one of the better places to look at for where healthcare is really going. And you can go to this site and see, well, they're saying, well, in 20 years, 21 years, maybe all these things will start happening. And it talks about the three, sort of the three distinct periods that folks go through as this whole process of getting to a better place happens. And it was pretty amazing that when you look at all of this, there are like 6 different issues that we're trying to figure out how to deal with. And they involve data sharing, interoperable data, access to data, empowering consumers, behavior change, which nobody really has any idea how to impact, and then the focus on scientific breakthroughs. And when you look at what they share here, it's like they're saying that, well, it's going to take 1 to 7 years to just start getting people sort of acclimated, and then it's going to take 7 to 14 years to go through this stage which they call proliferation, and then it's going to take another 14 to 21 years to have any kind of transformation. And when I started thinking about all the things that we were doing and knowing of the success that so many people are having when they have the right sort of benefit advisor in play, that's a timeline that doesn't have to, we don't have to live with. And so I think for those that are really trying to impact healthcare, these are sort of the things that you really kind of have to dig into, so you really understand that these things can begin to happen when you start bringing in the right players. So there's one other site that I wanted to share with you before I got right into my sort of presentation, and this is another consulting group that talks about, what's the future of healthcare leadership. Everybody's saying that you've got to create, if you're going to have any impact, you've got to create a consumer-centric organization. Well, how do you go about doing that? This group came up with some really interesting insights that I think is worth pointing out, and it's honed in right on what healthcare consumers really want. And so it's not like we don't know what everyone wants. Easy access, appointments when at a convenient time, regular communication, lower cost, access online. This word called transparency, which everybody talks about and nobody can seem to get to, and the ability to choose their own providers as opposed to the narrow networks that tend to get forced on consumers because most of healthcare is controlled by insurance carriers. Technology that supports goals, and personalized care focused on the individual. So all these things that they're saying should take or are going to take 20 years are happening all the time right now when you have the right benefit advisors in place and you have an employer who has a population that they can control what that benefit plan looks like. One of the interesting things on this particular site that's worth taking a look at was they tell a story about how they set up an exercise for the leadership team at a community health center, and this is it may not be unlike what you would find at a hospital, and they asked them to assume a football field and put the primary healthcare stakeholders, in a position. And so, as you could see here, the patient would often got labeled as a spectator, a referee, or someone carrying the ball, but only one group considered the patient as quarterback. And so this sort of speaks to the fact that there's a lot of everything's kind of disconnected, and it's because the hospitals and many of the folks that care for us as consumers, they don't have to be any more connected than that. And so there's so much that has to be done in order to make the impact that we're looking for. So so I came up with this as the way to solve the problem. And if you think about this, right there at the middle, you've got concentric DNA. And it took me about 7 or 8 years to understand how all these pieces work together. So you can take a look at this and you can begin to appreciate, well, that's why it's going to probably take 20 years for all this stuff to get worked out. But the thing is, we have a team now, and that team includes the people that are on the bottom there. And you can see Jeff and Charles are listed. Massey's on there. Joe works with us, and Dr. Arsad, who created the WOW Health Solutions, which is the technology platform we're going to talk about, and of course Jim Walbrink, who is a gentleman that sort of figured out how to make community coalitions work. And so at the end of the day, the real problem with healthcare is that there's an effort to bring in technology to solve the problems, and nobody really knows how to humanize the technology so that it can work in the context of this regulatory environment that we're in. And so what we have now is a regulated third-party fee-for-service environment, which creates a very contentious environment. And it's almost the price we pay for abdicating control. And so what you have represented here is you've got things like 4 10-minute appointments. You've got care that's blocked because there's a lot of physician disengagement. You have physicians burned out. They don't really have time to innovate or treat anyone in the way that they'd like to. And you have hospital systems whose costs just keep going up based on discounting arrangements that they have going back and forth with the insurance carriers. And so you've got a lot of uncertainty around value, and you end up with everyone being fairly unhappy. But the problem is that the people that are unhappy really are in urgent need of someone showing them how to gain more control. What I came across several months ago was technology called WOW, which sets up the process for to be able to pay cash for their care. And what that does is it sort of becomes the domino for all the other things that need to be happening, in this environment. And in essence, what that does is it decouples inpatient and outpatient care, and it allows instead of 4 10-minute appointments, you can have 4 40-minute appointments. You can have the right diet and activity replace needing to have medication. You end up with physicians being invigorated because they have time to innovate. You can show the hospital systems how they can increase their marginal revenue. You give employers a way to drive out system waste and inefficiency. The benefit design itself allows that to happen, and you can end up really segregating the care that needs to take place outside the 4 walls of the hospital, and you can pay for that differently. And so that's kind of what I have come to over time, realizing that if you put all those things together that are talked about here, you look at the doctor visits, the clinical pharmacy spend, the clinical inpatient spend, the elective procedures and tests, all of which are totally controlled by insurance carriers that only profit if we spend more money, right? And so what this interface does is it sets up cash payments for all those things that were previously third-party reimbursed. So we've gone to employers, or what's already happening with a lot of benefit advisors throughout the country is they're reducing what costs have been reduced by 178% over the last 14 years. I'm not sure where that stat came from, but there are examples coming up every day where when you have the right benefit advisors involved, employers are being empowered to make all these things happen. What our structure, starting with this decoupling of outpatient cash and inpatient care, what that does is it sets up and it empowers employees to really become a strategic advantage with respect to the benefits plan for all the things that are happening with respect to what that employer is hoping they might do from the standpoint of being involved in creating a better culture and having everyone more involved in that. And it empowers the brokers because they can become advocates. It empowers the physicians. And it even can empower the insurance carriers because they can use this technology and use it to actually lower cost and reduce their claims because they can reduce, because the whole setup drops the process of having to file a claim for care to take place. And at the end of the day, it can also empower health systems because it can bring in the use of clinical trials and a medical value index that enables this whole idea of consumer-centric medical management to take place. So,
Jeff, let me interrupt you for one quick moment. Why don't you explain to those that are kind of the layperson what that medical index is talking about?
Sure. So we have a health plan that is provided for employers that have over 50, and it allows the employees to go to any hospital facility for only a 10% coinsurance. And the way we decide which hospital facilities deserve that tier 1 10% coinsurance is by using a medical value index, which has been uses CMS, the Center for Medicare and Medicaid Services. It uses all their data to really help that employer know where are the best values for them to for their employees to receive medical services. And so there's something in it for everyone when you go back and look at our sort of basic plan. This is sort of the blueprint right here, and the medical value index ends up becoming a really key component of this, because it provides a common benchmark that you really can't argue with. And as you can see from this chart, there's a lot of things on here that end up needing to be explained, and that's pretty much what our process does. And let me talk a little bit about that, because there's so much confusion about what you can do and you can't do. The approach that we're taking to the large employer marketplace is we assist the broker in contrasting what they have currently with what they could have. And we do it with folks that are very well established and have all the professional credentials that one would have to really command the center stage in those types of conversations. And we set up a contracting framework that can include the employer as an engaging party. It can include the hospital as an engaging party. It can include the benefits broker, or it can include, say, a physician group. And so it all depends on who wants to take the lead in any particular area. But that's sort of the special sort of sauce that I believe we've created. And this framework sort of describes how that happens. Any questions?
Jeff, I'm sure we're going to have a bunch of questions. One of the things that I think you sort of danced around a little bit is the luxury of this WOW app, is it forces the market to be seen. As I've said before, you may be a cash paying patient and you call a bunch of places to figure out what things cost, and then you pick the one you go to, but none of those other doctors that you declined to go to really understood what everybody else was charging, or maybe why you didn't go. But inside the app, because everything is visible to everyone, they're going to see how they stack up against their local competitors and so on, which will force them to increase services, lower pricing, and gets to that point. And again, what's nice about it is the customer makes a decision, so they don't have to worry what it's going to cost, or this is that too expensive or whatever. They pick what's comfortable for them, and they're making that decision. So that's a fabulous situation. All right, here comes some questions. So let's get going here. Paul, I see your hand is up. Are you there?
I just wanted to say, great presentation, by the way. I'm interested in a value-based system, and how we can kind of promote that view going forward. what is your take on a value-based system in terms of transitioning to that versus the 10-minute examination, for example?
Paul, this is Dr. Tom Davis. I'm one of one of Jeff's advisors, and as we were discussing on the conversation board, that value is defined by the exchange, the fact that an exchange takes place between the consumer and the seller. Value-based care, as we understand it, is really simply a way to justify certain payment patterns as determined by the payers, either the government or the insurers. Value is decided at 30,000 feet, far, far away from both the consumer and the seller of the healthcare service. Whereas in virtually every other marketplace, it's the person who's buying the service or the product that determines its value and how much that value is worth to them. And that is the beauty of using a cash pay system, because the price is a very visible marker of the value that a particular service has. And to expound on what was just said, a physician who is on this platform is going to decide how much they are willing to sell a given service to, how much they're willing to sell a given service for. And if there are no buyers, well, then they have two choices. One is to lower their price. The second is to significantly increase their price, because there is a market segment out there that sees high prices as a marker for higher value. That's certainly a valuable strategy. Or the third thing is to slice and dice or innovate new service segments that they are willing to provide for a given price. And it's that ground floor innovation that allows value to be created by the seller deciding what they're going to sell for whatever price, and then the buyers deciding whether or not they want to buy it. And that's true value-based care. I consult with Medicare Advantage folks all the time, and the value-based care systems there are really understood to be more of a compensation adjustment system, try to hold down expenses for the payers by deciding at a very great distance from the patient what's good for them. And it's odd that the patient is never really allowed to decide what is value for them.
Yeah, I look at it as quality over quantity, so I think you're onto something for sure.
There's a great example here in the healthcare industry. We have a huge market segment in America in healthcare that's totally consumer driven, and that's for elective procedures, including cosmetics. And when you look at that market, you will see that people can correctly interpret price as a marker for value. And I'll give you an example. There's plenty of places you can go to get Botox for $15, because Botox, even if unless it really goes bad, it goes away. Sure, I'll try Botox for $15, but nobody offers cut rate Lasix. Okay, and that's because nobody wants to go to somebody that's a very, very low price for their eyes. There used to be a market for that. There in St. Louis, there was $99 LASIK. Can you imagine going to someone, let them cut on your eye for $99? Well, it's not there anymore because nobody took them up on it, because people are smart enough to figure out that they don't want somebody cutting on their eyes for $99. So there is a tremendous paternalism in the healthcare marketplace, that people can't determine what's value and quality because of the asymmetry of information. Where the real story is people are hiding behind that because there's so much money being made.
That's a good point. Yeah.
Charles, I see you've got your hand up.
Excuse me. Thank you, Jeff. I think on value, Jeff Ellington, we have some friends in our circle that through WOW or otherwise might be offering some ways to bring value to the decisions patients make on their care and how providers are compensated, not so much for fee for service, but for following best practices based on outcomes research, particularly in the pain side with some of the alleged overutilization of back surgeries and knee surgeries and that kind of thing. I'm hopeful later this year we'll have some of those entrepreneurs present on this weekly cash patient webinar. I'm sure Jeff Cantor and Ellington, you know who I'm talking about.
Yes, in fact, one of the that was sort of part of the preview that I tried to provide for what we were doing here, and
right there, yeah.
I think, yeah, there's a gentleman by the name of Brad Willems who has pioneered a really probably the most sort of incisive look into the sort of the whole process of musculoskeletal diagnosis, and now we're working with him to create essentially networks of excellence that can become part of an employer's benefit plan, so that the 20% of situations that occur that are going to end up costing most of the money, they end up being served through Brad's process, because, you know, and I didn't really know this until recently, and that is that nearly 70% or more of back surgeries are really not even necessary, and it's only because they do not get the right accurate diagnosis in the first place, and our system just is not currently set up to encourage that to happen, and certainly that's one of the very things that we set up to happen within this crazy complicated model right here, where the focus is on continuous improvement, and you necessarily make sure that you get that accurate diagnosis in the first place. And Dr. Brad Willems is who is the fellow that works with the ADX sort of look at musculoskeletal issues, is the brainchild behind that, and we've already brought him into. He's actually an embedded part of the benefit plan design that we're taking out to the market for employers over 50, and it's so remarkable that we can literally go in and guarantee at least a 10% rate reduction just based on what he's doing for any large system of employees, and that's a pretty big deal when you look at how much cost is being spent, in that particular area. And I know I have some folks on the call that could easily speak to some of the misplaced incentives that are out there in the brokerage and advisory space. But I was just on a call earlier this evening with Brad and another young lady that works in the consulting space, and she mentioned to me that Brad is actually being thrown out of some of the TPAs that he was working with, because they get paid on a percentage of money that is spent, and because he's reducing costs, he's having to find the TPAs that are just like the rest of us. They're trying to make sure that the right care is provided and money's not wasted. But it's a fight to find the right people to work with. And so, certainly our hope is that as we share what we're doing with the kind of people that are on this call, that people will find out about what we're doing, and it'll just keep adding to the critical mass.
Medical cost sharing systems have a great have had great success with ensuring these centers of excellence, so that if you are recommended back surgery by one of the physicians that they know is not an overutilizer, then you get your back surgery. But if you get back surgery from someone outside that list, then you gotta get a second opinion before the community will consider covering your costs. So there are third party ways of ensuring quality that really quality surgeons shouldn't have a problem with. But you got to start somewhere. You got to create the marketplace and then fine tune it. And the WOW marketplace is a great minimum viable product to get started.
Mark, I see you've got your hand up.
Yes, I just wanted to take a few seconds and identify, a little bit more about the value-based initiatives. I am a computer technician, not a doctor, and I have been part of the executive staffs that built the value-based initiative coding for both Aetna and Optum, and I can tell you that there are staffs of as many as 600 computer technicians, most of them from Asia, who don't have any idea about the US healthcare system. And they're the ones building our value-based initiatives. That's all I wanted to say.
You mean the carriers are hiring them?
The payers.
You mean CMS? CMS is hiring them?
Yes, CMS as well, yes.
That's interesting.
And in the
interesting and not surprising.
Yeah, I was going to say in the warped mind of government, that makes total sense. That's what they would do.
Because it's cheaper.
Yeah. And they don't understand that we're trying to get to an outcome. They're just looking at it with the wrong lens as usual.
Right. It's not about improving outcomes. It's about decreasing its compensation to the providers. That's what it's about.
Pretty much. Jeff, were there some concluding remarks you wanted to kind of put a little bow on the rest of your presentation here? I see you had some other screens up.
Yeah, I've got, there are a lot of healthcare heroes out there that are trying to make these sorts of things happen. I've listed just a few of those. I think the list will certainly just sort of keep growing. For those folks that are interested, I wanted to mention that we've got some things coming with our appendix. There's a narrative I think that I pulled up earlier for strategic partners that we're putting out there for folks that want to spread the word about this. Let me see. I think I had. So we can share this with anybody that would like to see this, or just email me if you'd like a copy of this, because it's what we're using to sort of get the discussion started with folks that are out there and really want to put capital behind the types of things that we're doing. And let's see, this other narrative, which I think really gets to the crux of what we're doing and sort of why, is it really speaks to how our operating units are set up within that crazy diagram that I showed earlier. And it speaks to how we're using this whole process to basically elevate and validate trust in different areas. And at the end of the day, if you can figure out how to elevate the people that you work with and validate that trust through the technology, the reason doctors hate technology so much is because it's essentially just been a drill for the electronic medical record companies to tell them how they're going to be paid. And so we've taken the approach with technology, and Tom Davis is really sort of helping us head this up. He might want to speak to this, is that we are really humanizing the technology. And we're doing that in a way that allows folks that want to help us spread the word to make it really easy for them, people to see how easy it is to work with their physician if everyone is using a platform that makes virtual care easy to be provided, so that you really only need to go into the doctor's office if you really need to be there. You don't have to go in there anymore just so the doctor can be paid. Tom, I don't know if you want to speak to that for a second, but we're real excited about some things that we're coming out with that is really going to make it easy for our advocates to spread the word. Tom, did you want to say anything
Sure,
about that?
we're developing some marketing lead magnets that will explain exactly what the role of advocate is in terms of getting leveraging their relationships professionally with WOW and getting those physicians to participate in the marketplace. And the beauty part about this is that with WOW, as a physician, you can basically put up any legal service you want and a price for it. Telemedicine, for example, is a huge thing. You can spend $20 per call to get a cross-coverage doctor that you don't know about. And in 30 years of practice, I never made a nickel. No insurance company ever paid me to take a patient's call in the middle of the night. I was just trained that that's the way that that's the way that you do it. But under the WOW platform, hey, you know what? If I don't want to go a full subscription kind of direct primary care model, I can say, you know what, for $20, I'm available for you for 5 after-hour phone calls this month. And you won't have to take, potluck like you would in a telemedicine service. I'm there for you for $20 or for $40 or for $50. Set the price point where you want. And in this way, the physician gets compensated for the service and the value he provides, and the patient gets exactly the service that they want. And it also reflects the true quality of care. That's the kind of flexibility, innovation that a physician advocate can propose to their peers with whom they have credibility to help enlarge the clinician footprint on the platform.
Very nice. Charles, I see you've got your hand up.
Sure, Jeff and Jeff Ellington, great discussion and some good add-ons from some of the participants. When you've been speaking with TPAs and large benefit brokers, what are some of the elevator pitch talking points that have gotten good feedback for you on, the large group offering through WOW?
I think one of the things that benefits brokers are pretty excited about is the ability to deliver an ACA compliant minimum value plan. Most of the plans that are out there now, if they're usually at best gold. Most of them are silver, but you never find what's called a platinum plan that's being offered at the employer level because it's just so expensive. What benefits brokers are really being drawn to is the fact that because of what WOW is able to do in setting up most of the payment for medical services to be done in cash as opposed to being reimbursed by a third party. That plan has a 90% plus platinum rating, and the employer saves on average at least 15 to 20% minimum. And even after doing that, employees go back to the time when they're not paying anything in premium. That's the way it used to be. Right now, so it's like they're able to give, a benefits advisor is able to give their employer's employees an immediate raise when they put in a plan like this, and they can also anticipate a time when, instead of fighting for a renewal every year, they can basically engage in a discussion about how to continue to improve their health care of employees.
Yeah, Jeff is right there. The pitch that really resonates with these folks is the fact that WOW has a structure which allows the employer to unlock a asset that has been previously completely unutilized, and that is the employee's engagement with the process of getting their health care. Currently, it's very passive, it's very complex, and the patient really acts as a passive player in this. But once you take all of the different structures, the marketplace, the zero premium, the active participation in the shopping experience, suddenly the employee becomes a partner with the employer in actually holding down how much is spent. And that is the pitch that is really resonating when you count it in terms of an untapped asset that's incredibly powerful that WOW allows to be released.
Power of the market once again. Kathy, I see you've got your hand up.
Yes, I do. I have two quick questions. First of all, as someone who's not really connected with anybody except for this one surgery center and doctor, I don't really have a lot of connections. How do I advocate for this platform? And two, with you talk about the ACA compliant thing. Now I hear a lot that the ACA could totally collapse because it could be declared unconstitutional because the mandated coverage, which has the tax penalties, no longer existent. So kind of how do you handle that ACA compliance if the ACA is going to collapse at some point?
Well, Kathy, the term ACA compliance refers to a quality marker. So that is defined as coverage that the federal government at the time of the passage of the ACA felt to meet the definition of quality, meaning that there's a laundry list of preventative services that are provided at no charge to the patient. There's a certain level of premium or certain level of funding that the patient pays in that they get back in terms of benefits. So ACA compliant is really a marker of value for the individual, and for the corporation, it's a marker that, hey, this is coverage that fits that requirement. So as long as the law is in effect, if you get this level of coverage, you don't have to pay the fine, because companies over 50 employees have to pay a very, very hefty fine if they don't offer insurance. So that's why the term ACA compliant is in there. It's a code for quality, because we don't want people to think this is quote unquote junk insurance, which is what the pejorative that the insurance companies use. But we also want the businesses to know that, hey, this counts. You don't have to pay a fee. And all you have to do to advocate for a provider to do this is you go to them, talk to whoever your contact is, and say, go to wowhealthsolutions.com and check it out. And you can certainly give them my name or Jeff's name, and we're happy to speak with them. But the way that we're setting up the education funnel, it should make sense in of itself. And I believe WOW even gives a small bonus for anybody that gets somebody to sign on. So just the first step there is just to send them to wowhealthsolutions.com, and the site should take care of the rest.
Okay, thank you.
Paul, I see your hand up.
Yeah, this is a bit of a sidebar perhaps, but I see this as this forum as the tip of the spear, in terms of healthcare leadership in the industry. I wonder how we can, because it's so high quality. How can we promote, say on social media, for example, this webinar to get more folks to attend?
That's a really good question. And I think some of the things that Tom Davis is doing, I think are going to help in that regard. I think a lot of it is us reaching out personally to people that are that oversee large populations of folks that are going to naturally be interested in either the medical cost sharing piece of the WOW plan or the large employer piece. And I think as we begin as those folks begin to understand the value that this can provide to their organizations, that should certainly help a lot. I think continuing to sort of humanize the technology behind this so that it's more engaging and reducing, healthcare is so complex. I mean, you can see what I started with, that very complex circle of things. But we certainly don't typically show that, except I wanted to show that tonight so everybody could begin to see just kind of what was involved in just trying to understand healthcare. But what we really need to do, I think, is focus on the kinds of simplicity that the WOW platform itself does a pretty good job, but I think we can keep making it better. I don't know, Tom, what do you think?
It's important to understand that there is a lot of money being made, for lack of a better term, by people who are not sitting around this table. There are a lot of stakeholders who have a lot of deep vested interests. And so somebody whose compensation depends on not understanding something won't understand it no matter how effectively you explain it. So those folks, and they extend all the way down from the insurers all the way down to the independent physicians associations. They all are stakeholders and they all make money off the system. So to answer your question, it's important to get the foundation of healthcare, the people who are delivering it, to know that there are like-minded individuals who are discussing alternatives outside the system. And I think that is our greatest resource for change. Because remember, first they ignore you, then they laugh at you, then they fight you, and then you win. So we're in the ignoring phase right now. I keep on joking with Jawad, who created WOW, that he's going to have someone start his car in the morning. He chuckled at that, but I'm being completely serious about it once it starts taking hold, because there is a lot of self-dealing and feather bedding going on here. And if you put the purchase of healthcare in a transparent marketplace, all of that by definition goes away. And that's going to be very threatening to a lot of people.
What a great place to end our conversation here today, Tom. I really appreciate that. And Jeff as well. And the one thing I would comment, Jawad's one luxury is at least he's not like a lone guy with some, eerie message he's presenting. He's got all of us at his back as this thing continues to grow. It's going to be really hard to take that a guy out once he's got an army behind him. So it's really
Absolutely.
exciting. And I think we all can agree. And I think we all can agree the future is really, really bright. For the longest time, it's been dark, but suddenly it's looking awesome. And I've been slugging it out for 6 years in this trench. And this is a way that everyone has a place to kind of rally around each other to allow us all to succeed in this space. So it's really very good. So Jeff, thanks so much for being here tonight, and everybody else for joining and their great comments.
Thank you very much. It was nice to meet everyone.